Journalists who are here, introduce yourself and your media house and keep your question short and simple. Yes.
Thank you so much. Very interesting to see. Then we have this. First one goes to
which media house?
Radio One, like I was. First question is about how can one tell that they have lost self-assessment of mental status? How can one assess and tell that they are maybe unstable or two? You talked about the Ministry of Health recently announced that it was to decentralize this kind of.
Vincent, I can take another question. Yes.
Yeah, thank you. My name is Edward Muhums. I work for NTV. If I'm to stick to the report, when you look at the figures, I've had a reading that if I was to give a classification, I would say people have genuine fear. That one, they fear they would contract COVID-19. Two, if they contract it, they are likely to die because one, the facilities are not available, the facilities are full. Shouldn't that be the starting point? Because people will have to fear. You might cancel them in their homes, but as long as these facilities are not available in a country, then you're just perhaps not doing much. So maybe Emma or Professor, what needs to be done? Because people are going to continue fearing as long as they have that perception of the system. Thank you.
Thank you, Edward. Do we have another question? That gentleman there? Yeah, please, it's better you stand for purposes of capturing.
Good afternoon. I'm Yusuf Kayondo from Sanyu FM. Mine goes to Dr. Lukwata. You say that you haven't been supported to offer care to the victims. Kindly tell us what kind of support you need.
Thank you. Any other question?
Okay. I'm Samuel Kirimunda. I work with NBS Radio, Jinja. Mine goes to Manager Mujuni. How someone can stop the fear of COVID-19 after being affected? Thank you.
Thank you. Irene Abaro, who is on Zoom, you can ask your question. Do we have Irene Abaro? Please unmute Irene Abaro to ask her question. Irene, are you on? Hello? Yes, you can go ahead, Irene.
Irene, you can now ask the question.
Yeah, it seems we are unable to have Irene from the Nation Media Group, but Irene, you can type your question in the chat. I will be able to read it out. So my panelists, you've heard the questions. I don't know whether there are still questions among the journalists in the room, but if there are no other questions, let me recap the questions that came from Zoom, such that we have them all responded to as we head towards our concluding today's.
Recruit people who would have been counseling and then be trained for whatever facility. How many counselors were recruited? recruited to date? And were these only for the COVID treatment units, or there were also other people who are considered outside the COVID treatment units? And then if you look at the aspect of telephone counseling, this has been embraced by several civil society organizations, especially those in refugee settlements. But is there any plan or a way Ministry of Health is doing this at various levels, and how effective has this been? Thank you. I hope you heard me. I couldn't unmute myself.
Thank you for your question. Any other question from Zoom?
I didn't hear the last question from Irene.
Was that Irene? Okay. Irene's questions were on recruitment. I think telecounseling. The people who are close to the computer can help us. Yes, but mainly she's asking, did we recruit counselors? Because I remember there are counselors who were working within quarantine centers, the team of 4, a health worker, a nurse, a counselor, who were entering quarantine facilities. We had a lot of distressed people in the early days of the pandemic. So I think you will speak to that. So let me recap the questions such that we have responses at once. How can the people in rural areas access psychological support, mental health, and home-based care? They are the most affected. Is there a toll-free number for citizens to call for mental health? How do citizens access mental health services? What is government doing to build confidence among Ugandans on fear and anxiety? How many mental health workers do we have in the country? Can the Ministry of Health plan to deploy one mental health expert at each health facility in the country? Yes. To what extent has depression affected families? Who are the main culprits? Who are the main culprits between males and females in rural and urban centers? How is mental health being handled for medical personnel, as it seems they are the most affected? Is there any relationship between fear and one's immunity, what I called as psychological COVID? There was also another question: what is the Ministry of Health doing to strengthen self-help and support given mental health human resource gap at lower levels? Is there psychological support system in place for health workers? So these are some of the questions that we received from Zoom, and we are grateful to the people who have spent some time off their weekend to join this important conversation. I'm going to give an opportunity to each panelist, beginning with Dr. Hafsa, to wrap up with answering these questions. And I think we shall be heading into even closure. So you'll also give some concluding remarks.
All right.
Thank you.
Okay, thank you very much, moderator. Thank you, Emmanuel. And thank you very much for the listeners who have kept time and listening to us. There's something that I said I would come back to. I'm going to say it very briefly. There are lessons that we learned in the first wave that have helped us to deal with the second wave. And in the event that the third wave comes, I think we shall be much better. For us as the mental health and psychosocial support pillar, we learned that pre- and post-counseling were very, very important, and that there's always need to talk to people as they go through the testing itself, but also at the vaccination level. People need to be talked to, people need to be told what to expect, and prepare them for whichever eventuality that could arise. Then we also learned that giving information to people was very important. Initially, when we just started, we realized that during the quarantines, when people were put in quarantine and the isolation, they lacked the information. Many people didn't know why they were there. Many people were there was a lot of pain and denial, and But giving people information as they get into certain situations, we found that it is very useful and can help someone allay their fears and calm them down and may not get into, that bad stress as we've learnt about it. Yes, also allaying fears and worries. People have different worries. Just listening to someone and getting there to tell them that you're there to help them, we found was very useful. And this is where our counselor colleagues come in very handy, and we really are into helping people and asking that let the counselors actually enter the room. So allaying fears and worries and listening to people, just even listening, telling them that, we are there to help you, is something that is very useful. Then the communication, this one is very important, especially for the healthcare workers as they are giving care. Many times people are just given maybe an injection, or they are given their tablets, and they may not know, the person may not know how to take these tablets, whether they should break them into two or take them all at once, because, we had shortages in PPE, so it was like if you had a dose to be given, they would come in once in a day. So the communication was sometimes not very clear to know that maybe I need to take this number of tablets during the morning and this in the afternoon and so on. So we learned that communicating whatever we are providing to the patient was something that was very useful, and so we are emphasizing it in the subsequent waves. The other one was stigma comes in many forms. People can self-stigmatize themselves, if someone comes, if you go closer to someone and they put on their mask, then you find that a problem. We'll try to tell people to understand certain things. If someone put on a mask on seeing you who has been in an isolation, I think it's okay. They're trying to, protect themselves. So please take it and don't stigmatize yourself. It's not stigma. The other person is trying to, and there are so many examples to that effect. So the self-stigma also comes in, so we should also avoid that. But then there's also the stigma that comes from outside, where, people choose to discriminate you because, of your status. So these are things that we learned and have really helped us in dealing with the situation. Then to go to the different questions that have been asked, I will just be very fast. And yes, someone was asking about mental health well-being in rural areas. What can be done? I think what can be done in the rural is the same as what should be done for mental health. For as long as you have a brain, whether you're in the village or in a town or wherever you are, the brain has to be helped. And whatever strategies that we use are the same. We're just telling you to eat well. The nutrition is very important. We're telling you physical activity. By the way, we have not gotten an opportunity to tell people of that special exercise that we give as mental health providers, the breathing exercise. The breathing exercise is so wonderful, and it can bring great results to people. Calm down, and someone feels much better. Then there's sleep, having that enough sleep. Colleagues have already alluded to that. And then the last but very important thing is treating infections appropriately. We're having a problem, and I'm sure if I talked about this, I think it would have caused the Pandora of questions. But people are treating themselves with all kinds of concoctions. There are lots of concoctions that people are onto. And my advice is, those of you who are taking the marijuana from the garden and just putting it in whatever you're doing, that one is very dangerous and it will cause you lots of problems. We know people out there are using marijuana, and you're seeing it on social media, that it's a good thing, it can treat your pain and so on. But the kind of pain that it treats is that severe pain for cancers and, the sickle cell crisis and so on. It doesn't treat these simple headaches and whatever that we have during COVID-19. So, and even then, it's the crudeness. The kind of marijuana we are taking just right from our garden and putting it in a cup of tea is so crude. You're taking on even those other toxic chemicals that come with it. Those people out there at least extract the real, only that thing, the useful part of it. But for us, we are taking everything as it is, and it is very, very dangerous. And then there are lots of other things that people are doing. They are steaming. You need to be mindful of the temperature that you're using to steam. That is very important. But also, there are certain species that you've been told about that can help you to treat COVID. I think, yes, it is to an extent, yes, but again, you need to be very careful as to what you do. Don't overdo it. People are getting ulcers. People are getting so many other complications because of these traditional things that we are trying to use. So we need to be very cautious. If you've tried Yomululus and it is working for you, you keep that. And please don't take it all the time. Don't take it all the time. I mean, please just follow some of the instructions that are being given to you by the Ministry of Health. Even the SOPs minus those things can actually help you to protect you against COVID-19. Yes, there's a very close relationship between fear and immunity. This is something that has been asked. Yes, when you're in so much fear, your immunity tends to go down. But also, you may fail, even if you're on medication, your medication may fail to work on you. So it is a whole, we can discuss it for a whole day, how these two are related. But please be it known, when you fear, one, the pain will be so much, but even then, your immunity will go down, and even some of the medicines will not work on you. That is why you saw that it was so important during the care for people with HIV that they brought in counselors to calm down people, to help them calm down so that they can take the medication properly, even the adherence, to help them on the adherence, but also to help the medicines work on this person. It's a psychological thing, but it is real. Yes, please reduce on the fear, accept the situation you're in, and then you'll be well. So for the healthcare workers, yes, this is very important. We've had, in the previous response, we tried to reach out to the healthcare workers, and unfortunately, we fell on our faces. These are people who felt that they could manage, that they could cope, they were highly resilient. And at that time, we said, okay, maybe we're not seeing much of the manifestations of stress and burnout at that time. Unfortunately, during this time round, in the second wave, we have noted that the health workers actually are burning out, because they're the same ones who started responding in the first wave, are the same ones who have continued during this time. So they are really, really tired, and things are not very okay for them. And luckily, this time round, they have accepted to actually be helped. As government, we have set out, we have written to the different CTUs to set up a day. Actually, we're asking for two days, 2 hours, to help people, to help the health workers deal with their stress, to de-stress, that matter. And they could use there are so many things that they can do. Some can do some games, they can do exercises, they can do some intervention. There's some, interventions that can be helpful. So we have called out to all the CTU managers to set out a time to help healthcare workers. And it is mandatory. It is not like it's by choice. It is a must that you have to, as a health worker, during those debriefing meetings, you need to set aside time to help with your mental well-being. I've not talked about the spirituality. I hope my colleagues will talk about it. It is something that we need to emphasize. Whichever religion you believe in, whether Mama Fina, whatever it is, whichever you believe in, it is very useful for your mental well-being. Again, as a ministry and the government, we have set out guidelines. There are quite a number of guidelines. Those of you who may want to have a look at them, you can do it. We have guidelines for management of COVID, mental health and psychosocial support during quarantine. This is, initially it was quarantine, the other one of institutional quarantine, but when we let it out to the home-based care, then it's the same instructions, the do's and don'ts, and just helping people. And usually quarantine is when you're asymptomatic or you're caring for someone, you're asymptomatic or you're caring for someone, you've been in contact with someone who is positive. So the guidelines are there. Then we also have some guidelines for within health facilities or CTUs, how to care for the person, what to do, the eating, the washing, taking the self-care, and so on. Then of course we have also for the healthcare managers, those that are taking care of the health workers. And one thing that I'm picking just a few things from all these guidelines, but one thing that we're emphasizing in this particular guideline is the taking of water for healthcare workers. It is very important that the workers take water. One, of course, for the rehydration, that is very important, but also for taking time off. When you take a lot of water, then you'll have to go to the toilet, So some people can become so busy that they've not even gone for a short call, So we're saying that if you're taking water, that may prompt you, that may be a reason you cannot keep your bladder full for a long time. So at least it will be a reason for you to at least step out and go to the toilet, and then you'll have done a bit of the exercise, but also taken off time off the busy schedule. Then, of course, the self-care. We are emphasizing a lot of self-care. And in this, we are telling the health workers to allow to be helped. Like, please, when they are telling you that this is a problem, please accept. Or if you're going wrong here, please accept. That kind of care, that kind of support that you need from others is what we emphasize in some of these self-care guidelines that we've written out for healthcare workers. We also have written out guidelines for the elderly and the other vulnerable people. You know that the elderly people are very prone to COVID. Did you know? Of course, even in the first wave, yes, it was, but even in the second, they are more prone to severe disease. So, of course, when the COVID came in, it was already they are having issues. You know, they're aging, they are not working, they're all those things. And then on top of it, they're the ones who are mostly badly affected. So we needed some guidelines for them, and this was just mainly helping them to cope with the stress and to reduce on the worries and to care for themselves. And of course, the treatment is very, very, very important. Taking care of, like checking on their vitals, the blood pressure, the sugar levels, and so on. That one is very important. But also, not to allowing foreigners or people to just come in to visit. Yes, it's important to have visitors, but it's not good to have the face-to-face visitors. These are some of the things that are coming out in the guidelines for the elderly. Then for the burial and grief, someone asked very specifically, when do we come in and so on. The guidelines that we have, unfortunately, were in instances where the burial is guided, like, in most epidemics, we have a burial team. So, we help the burial team to help other people cope with their, the grieving and so on. So, unfortunately, they are at that level. So now when it comes to open burials, like everyone buries for themselves, then there's a bit of a problem. But I think with the home-based care guidelines, I think it can be incorporated into the home-based care guidelines, where we help the general public to manage these burials. What we were emphasizing in those ones, that there are certain people who do certain rituals. For instance, there are people who are allowed to put, eggs on the car before it takes the dead body. Well, like, we can, if it is not going to kill the vehicle, if it's not going to affect the vehicle in any way, this is something that we can let people do, just to help them to manage their the time after. But also, we've seen people who have innovated and said, if you want your eggs, put them on a piece of paper or plastic. So if the vehicle goes over it, then this plastic can be picked and thrown away, so that you do not litter the whole compound with these egg remains. So there are so many ways we could help people to actually do whatever they have to do, traditionally or whatever, for as long as it's acceptable, it's something that can be allowed. So these are some of the things, but also viewing the body. In Ebola, it wasn't allowed for people to view the body, so somehow you wouldn't know whether it was your person you buried and that kind of thing. So in that regulation, in that guideline, we are saying that there should be someone at least to witness that the person who is being folded and to be buried is actually their relative. So, and that is something that was put in the guidelines, but they can be adjusted for the general public, just like I said. So, on my parting remarks, the counseling, sorry. The counselors, how many counselors did we deal with? I have a total of about 58 counselors that we worked with during the previous one. This particular one has been a bit tricky. Colleagues, you know that we've not had funds to pay off, but even the situation has been a little different. So the counselors, we worked with 58 counselors in the last response, and these ones are still at large, they're available, but this was for only Kampala and Wakiso. The regional referral hospitals, the CTUs are within the regional referral hospitals, the mental health facilities, those beautiful ones I was telling you about, they're the ones they chose to put the CTUs. And in some of them, the workers in there were chosen to be part of the system, but for some, they were actually thrown out. The mental health workers were thrown out of their mental health units to offer mental health to the people. It was that bad. But anyway, currently, at least there are more than 3 people working within each of these CTUs, in the different regional referral hospitals, to care for people with mental health problems. So the telecounseling, yes, we are developing guidelines. We are developing a standard for telecounseling. We've appreciated already that there are quite a number of civil society groups that are providing this service. But luckily, we have a pillar, the mental health and psychosocial pillar, which sits every Monday afternoon, and in that we call in all those people who have actually, who we hear are offering services, and somehow we've agreed, we have taken them through a training on what they should, the kind of information they should give, but also guidelines on how to provide the telecounseling to the general public. So we have some guidelines, and we are doing some, it's not 100%, but at least there's something happening. Thank you very much, moderator.
Thank you very much for those remarks, and thank you to people who asked questions. We shall have
Okay, thank you, moderator. And I think Dr. Hafsa has touched quite a lot, and I'll just hint on two things. Somebody, I think Vincent asked about a self-assessment, just simple assessment of the mental status. And I'll emphasize that if you did an assessment holistically, you assess yourself physically, assess yourself emotionally, assess yourself spiritually, and then socially. Those dynamics will be very helpful. Physically, when you listening to your body is very important. From a counseling point of view, listening to your body is important. How is your body reacting? Are you suddenly getting palpitations? Are you getting sweaty all of a sudden? What about the headache? There are some vitals that you would look out for. General body fatigue. Some of those, if it has not been happening, and it is happening, and it is going on, say, for a prolonged period of time, it is important just to check out. There could be something that might need to be attended to. How do you react emotionally? I think when Professor was taking us through the mental health and what it is, your reactions, how you feel, how do you express your emotions? If you notice there are some changes, that might be also something you check out. In maybe when you receive news, how do you react? How do you express yourself when you're happy, when you're sad? That is good. Spiritually, we believe that it's natural for everyone to have a supernatural being that that gives them a sense of hope. So during times like this, when times of uncertainty, our sense of hope is shaken, and when you notice that you're losing hope, becoming more hopeless in terms of believing in a supernatural being, then you might check out there. Do I need to strengthen? What do I need to do? And then also socially, tendencies to isolate. You just suddenly feel you don't want to be among people. You just want to be alone for prolonged periods of time. That is also something to check on. And what preoccupies your thought when you are alone, that might be important. So it kind of should go holistically, to be keen to check that you don't lose out on any part of your state of well-being as an individual. I'll also comment on the issue of fear and immunity. I would like to say that fear it's a bodily reaction, and that is induced by a process that goes on in our brain. We have a central nervous system. We have a control in the brain that if we are exposed to, we call them stimuli, if we are exposed to a situation, COVID pandemic, sudden death of somebody, or bad news, you get a headline and all that, those are stimuli, things that happen in our environment. It quickly sends a message to the brain and forces the brain, puts the brain under pressure to react in a certain way. I think, I don't know that it was Professor, or it was from the statistics that we saw. Some people are actually forced to comply with the SOPs out of fear. So some fear can actually be positive. It can spur someone to action, to say, no, I don't want to die. I'm going to follow my SOPs. So it induces a bodily reaction as a result. So when that is happening in your brain, you'll find someone will naturally start, if you have ever been faced with fear, anything that would cause you to fear, there is a way your body reacts. Your heart starts beating faster, you start sweating, some people just tears start rolling down their eyes. There are some of those reactions. What is that? It's because the brain has sensed something and it is causing those reactions. So when that happens, it's good to look out for what is it causing, how is it causing you to react, and then now that's when all these coping mechanisms that we have talked about would come into play. But as a counselor, when somebody comes to you for counseling and is fear of the unknown, anxious, what is key from a counseling point of view is to help someone to identify with what they are afraid of. Some people do not know what they are afraid of, but you can tell they are afraid. So the process helps them to name their fear. It is very difficult to attack something that you cannot name. To support them to name their fear, what is it? Could it be this? Could it be that? So when someone is able to bring that fear to the surface and able to name it, you support them now to build coping mechanisms. And over time, people get resilient. And when they are faced with a similar situation over time, they are better able to manage. So the counseling process focuses on building resilience and helping someone to face their fears in a professional way, but also to build a reasonable level of resilience so that they are able to manage, even because we are not saying that after COVID, that is it. We don't know what next. If faced with another threat, they are better able to manage. And yeah, so I would also just like to say that at Uganda Counseling Association, when this happened, we formed a task force. Just like you'd find when anything happens, the government would form a task force. We formed a task force, and we have a team that is ready to do interventions during this time. And we've been through a lot of sensitization of communities that we can reach, and we are trying to use as many platforms as possible to sensitize people and to be able to get them to see that there is need for the services, and they'll be able to use the services that are available. So my parting shots that each one of us is an ambassador in their own right when it comes to sensitization. It gets to my heart, to the depth of my heart, when I think about the fact that the very last person in the community who does not know anything about mental health has to comply, has to do what we are doing, has to follow SOPs, has to know that they need to go to the facility. If each one of us became an ambassador, because we represent big constituencies, and we start with our own selves. If we have anyone here, I mean, there are all those issues. You get to know that, you become an ambassador. I'm sure we can be a very big force, but also to extend my appreciation to Ministry of Health, to Twaweza for organizing this. And we need more of this, the media fraternity out there. Thank you very much. These platforms are very essential, and we need more of this as much as is within your means. Let us stretch until this message gets far and wide. We can do this, and we shall do it as long as we have breath. Thank you very much.
Very much, Elizabeth Okero, President, Uganda Counseling Association. We are also grateful to you, the panelists, for taking off some time to speak to Ugandans. And as a ministry, we continue to do whatever we can to ensure that we educate and give information. This is also partly under the risk communication pillar of the response, and it's spearheaded by the Department of Health Promotion, Education and Communication. The Commissioner, Dr. Richard Kabanda, has been following online, and also the team members, and also the Public Relations Unit at the Ministry, where I come from. We are ensuring that we put together and even make information available. It's part of the proactiveness in terms of communication. Let's have Prof, who will give us an academia insight into these questions, and we shall have Vincent and also maybe some remarks from Marie as we wind up. Thank you.
Thank you very much, Bwana Ineviona, for the opportunity once again. I would want to first and foremost start by saying that as you did introduce me in the first, at the time I'm a member of the Scientific Advisory Committee to the Strategic Leadership in the Ministry on this response, and specifically I belong to the Mental Health and Psychosocial pillar. And one of the things that we do at the level of giving advice is to bring research information, and as well as do research. And we have done quite some research. I can quote two that we have done. For purposes of helping us do advocacy, we published a paper with colleagues from the Department of Psychiatry on COVID-19 pandemic and how it has reinforced the need for community mental health care models in Uganda. It's a very short paper published in the Lancet Psychiatry, but tells us what was weak and where we can improve, because we are not going to stand here and say we have been angels and everything has been rosy. There are some areas of improvement that we point out, and more research continues to be done. But I would want, and we're also doing a randomized controlled trial, by the way, to look at psychoeducation intervention in mental health literacy in communities affected by COVID-19. That study is ongoing, but we have published a protocol in a trials journal. But I would want to say that to respond to somebody who says, how can one know, or how can people know that they have become mentally unaware? It is very easy to know that one is mentally unaware, but mostly it's other people, the community members, who will know at times before they are mentally sick, know that they are not well. Quite often you walk and you see somebody talking to himself, and the person is talking around. Then you start wondering, is this one okay? Somebody is pointing to a neighbor. But that could be a way to find out. But specifically, from the point of view of science, we can know that people, or you can know that somebody has started to be mentally unaware if they have started to, or if you start to see that they have started to lose interest in the things they used to enjoy. If you see that they have started to lose sleep, they can't eat well, they are lethargic, they have low energy, they are not satisfied with their life, with their work. Some start to say they wish they would die. Life is not worth living. They are emotionally and psychologically unadjusted. They are generally not happy. Then you actually realize that that's not normal. If you can use a very good tool, you will discover that perhaps underlying that which we call general psychological distress, this person is actually having a mental illness bubbling, and he may break down. And it is usually better at that stage you can handle with a psychologist or a social worker. They can help to manage the problem. If it goes beyond, then we may have to go into Butavika and other referral hospitals to manage a complicated mental illness. So on my parting shot, I would want to say that we need to have hope in spite of a hopeless situation. As communities, as families, we need to do so many things to prevent challenges, mental health challenges associated with COVID, but I would want to give at least 3 or 4. One, I think we need to manage exposure to media, especially social media. social media has become a terrible doctor these days. There is a lot of noise. So we need to manage exposure to media, electronic or social, so that we can consistently get messages from professional and trusted sources. Because we know that social media, for example, can increase fear and can increase anxiety. So for you to be mentally balanced, you can take a break of the media, give yourself a break, try to breathe in, to breathe out, to think and rationalize and see what is being communicated. Is it helpful or not? Secondly, I think we need to remain calm in spite of the storm in which we find ourselves. People need to remain calm. They should follow the standard operating procedures, which have been widely disseminated. Everybody, including children, know these standard operating procedures by now. Although we know that COVID-19 is highly expensive and has stressed the economy, the country, the health facilities, even families, a very big deal, and certain families have lost dear ones. The good news within it is that so many people survive. So many people get COVID-19. Even managed at home in home-based care, they survive, they recover. So that should give us hope, that all hope is not lost. It's a very small proportion that will end up in severe state to require health care or to go into ICU. So that I think for me that's hopeful, that's wonderful, but certainly we know that it's extremely expensive for those who have managed patients, especially in private health facilities, and that certainly compromises the health of the whole family and even the community because resources are channeled. The third point I would want to make is that we need to show compassion and kindness to one another. Let us look into our basic human attributes, humaneness, and compassionately relate with one another. These are times of fear. Certainly isolation and social distancing can bring about a sense of being lonely. So we can connect electronically, not socially. Yesterday I did publish an opinion in the New Vision. Some of you may have seen it. But basically I was talking about fighting an enemy within us, engaging deep-seated social norms amidst COVID. And I make one important point in that opinion. I just say, whereas you cannot stop a storm, at least you can carry an umbrella. And you'll go through the storm. So whereas we cannot stop COVID, it's a pandemic, let us try to follow those prescriptions and pieces of advice that have been given to us to be able to weather the storm and to get across this wilderness of this disease. We need to encourage, lastly, to encourage and actively manage our well-being, maintain our routines as much as possible, connect with friends, connect with family members, electronically, not our usual. Talk to friends, talk to OBs, talk to OGs, using all these electronic means that are available so that we remain connected. Ultimately, our society has survived because we support one another. When you lose a dear one, like some of us have ever lost dear ones, you can't imagine how people come support you. They still support. These days we are supporting, I can't tell how much money I spend through mobile money transfers for people who have lost dear ones to this disease. So let us not become so selfish. We should support one another through the safe available options at our disposal. We need to eat very well. Somebody has alluded to this. And we need to seek for professional help in case we feel we are losing control. Usually it's men who have a problem seeking and help, mental health care. Men should stop being proud. They should know that this is a threat for everybody. So when you feel like you are not in charge, you are losing control, ring a psychologist. I hope my colleague can tell you how you can get in touch with them. Ring a social worker. Ring any other professional, mental health worker or a general health worker to be able to be helped to manage what you think is a crisis. You know, when people commit suicide, it's not that they have the biggest problems, but because they have not shared, they think what they are going through is the worst. But whenever they share, that's one of the starting points of being helped, because they realize that actually their problem is an anthill, it's not a mountain. That's my parting shot. Thank you very much for listening.
Thank you very much, Prof. That is indeed valuable advice. And I hope people who have listened in, who have joined via YouTube, Zoom, there is value they've gotten from this discussion. Personally, I've gotten value. And I think I'll be a better person hours after here and tomorrow. So allow me give Vincent an opportunity to also respond to some questions and also giving parting remarks, because I think we have run out of time. We've gone over and above the earlier anticipated time, and we apologize, but the information being shared is important to save lives. Thank you.
Thank you very much. I think I have quite little to do as far as answering the questions is concerned, since most of the questions have been really answered. The one that I would like to emphasize, because it was raised about telecounseling services. There was a question that was raised in that regard, and I think it was coming in line with the *252# option 10 for free counseling that Strong Minds is providing. I would like to let you know that this service is free, and this service, at the point when it was tested as an approach to providing therapy, when we did the 8 sessions that they do for psychotherapy under IPT, we found out that the cohorts that went through therapy by that time, actually 78% of them came out depression-free by the time they completed the 8th session, which means that although there is a usual mindset that you should be seated face-to-face with a counselor talking about your problems, actually, it is also possible that under this situation, when we have all these restrictions working, there is still an opportunity to remain on course with care, and the option of teletherapy is still a viable option. In my opinion, as far as this is concerned, we actually could do well in terms of making this service known and available to quite a number of people who have a phone. But where you do not have a phone, we are encouraging communities to be creative. If my mother has a phone and I am the one not feeling well, we can share this phone and be able to get the service going. In events where the phone is missing in the whole household, I think I would encourage anyone who feels unwell, who feels in that state where they need to talk to a counselor, at least to go to their nearest health facility so that they can seek help. Moderator, I would like to wind up my talk with the fact that we've talked about all these symptoms and what I am supposed to feel to think I am mentally unwell. And I just wanted to let the people out there know that if you feel sad for one day and you are done, you feel better after the day, that is good. Actually, it is within your coping ability to wear out the sadness. That's how we are naturally wired, that we should be able to undo the sadness with time. But in events where the sadness, where the panic and the fear seems to hold you at ransom, not for a day, not for a few 1 or 2 days, but sustains this itself for a longer time. Probably, if you look at a 2 weeks mark, like you have been feeling like this for 2 good weeks, I think that's an indication that you're not dealing with something basic. You need to seek counseling help. And when you see a therapist, you will be able to address the core of your problem and find remedies and coping abilities, build coping abilities for them. As far as teletherapy is concerned, I'm sure many people are wondering, how are you able to cover the whole country? We at Strong Minds have also seen the need that has come with the pandemic. And part of what we have done is to size up, increase our team that is manning the teletherapy service. Some of our staff that have been doing in-person care have been recalled because they are not now interacting directly with community members to particularly support the therapy that is happening on the phone, because we know the need is high. Moderator, I would like to tell you, by the beginning of June, the Star 252 hash platform was registering about 1,700 clients a month. Right now, as we speak, by the end of June, it had 8,400 and something. And the beginning of July, by the 5th of July, we had already 4,000 people that had logged in, which means the times and the awareness that people are receiving is helping them to see that there is a problem at hand. And so my parting shot is, let's try as much as possible to do psychoeducation, to let the people out there know what they are feeling. Professor, they cannot interpret their emotions properly. We need to help them. We need to help them understand what psychological games their mind is playing on them in times like this, so that they can actually be able to seek the help that they need in the time when they need it. Thank you very much.
Thank you very much, and I hope people out there have taken this advice. I'll give an opportunity to Marlene Nanyanzi to give us closing remarks from Twaweza as we come to an end of this session. Briefly, is Marie on? Yes, please.
Stay with us this entire period, those that have been able to bring the live event at Africana, those online, those on YouTube, Facebook, we are really very grateful to the panelists for all the information that you have shared, and we really hope that we continue to support each other, our neighbors, our families, so that we are able to ride this storm and get out of the other end safely. Thank you so much. Stay safe.
Thank you, Weza, for making it possible for us. This is a great partnership with the Ministry of Health, and we are very grateful that you have made this a very impressive platform where the public can always get information. For the panelists, I hope you will give the Uganda version to the journalists in the room. The message has been great. I don't know how you compress it. Later on, after I've closed, they will come to you individually in case they are interested. Feel free to share your contacts, because I know very many people would want to host you on their programs, and feel free to be available, because this is the time we need to help our people get the right information, because we're still grappling with social media doctors, social media herbalists. There are so many things on social media, and some of this is not based on any fact, but just manufactured. But some, unfortunately, people are vulnerable to the information they find. From myself, I would like to say that the Ministry of Health has been committed to ensuring that there is mental well-being, and that's why we have a dedicated departments, and also on the risk, on the incident management team, on the scientific advisory committee, we have an issue of mental health and psychosocial support, and we are seeing it work for our response. I'd like to take this opportunity to appreciate our health workers, all the caregivers who are out there in the COVID treatment units. I know it's very hard, because personally, just by the mere phone that my phone rings from morning up to the next morning, it also contributes to when you find me, I'm almost talking alone. Because you're getting someone who needs an ambulance, someone who wants a permit to move after losing a loved one, someone who is stranded at the airport, has just been landed, is being taken through the testing. They are all stressed up, but they expect you to find a solution for them. So that alone, personal on this side, also affects me. So I hope that I will also contact counselors to see how I can cope as a communications person who is overwhelmed by communication requests. Yes, so I hope to try out to the toll-free line and see how it works. So I'll be grateful. I'd like to thank all those who have joined on the various platforms, the journalists who have come here and stayed with us. This is our third webinar. Ever since we started, I had earlier hinted that we started with community prescription and self-medication. We had a number of experts give advice. We had a team last week that clearly demystified myths around vaccination and also vaccines. Today, our focus has been psychosocial support, mental health, and home-based care. So we hope next week to have another interesting topic. The members who have been here will always follow the Ministry of Health Twitter handle and also their website for information. Stay well. I've been Emmanuel Ineviona, the Senior Public Relations Officer at the Ministry of Health. We have lunch which is ready. Please grab something to eat.